Hello everyone, my name is Luisa Sanchez. Today I'll be talking about the history of physical therapy. Very amazing, I know. Okay, so Hippocrates, 400 BC, father of medicine, he recognized exercising provided strengthening of the muscle. First physician to recommend therapeutic exercises because he knew atrophy occurred due to lack of mobility. A great man. He contributed significantly to physical therapy. Other important figures that also contributed to physical therapy were Aristotle with his rubbing massages and Galen with the kinetic principles in movement in humans. Anyways, let's begin. The formative years, 1914 to 1920. Physical therapy began between 1914 and 1918, the Reconstruction era. The Great War and World War One, and poliomyelitis epidemics, starting with a major outbreak in New York State in 1916, created this profession. Before and during World War One, there was a division of physical reconstruction which helped with physiotherapy treatment. However, after August 1917, William Gorgas authorized the creation of the Division of Special Hospitals and Physical Reconstruction, aiming to give disabled soldiers reconstruction therapy. There were 1,200 young unmarried women between 25 and 40 who were reconstruction aides and also orthopedists, which are the pioneers of physical therapy and occupational therapy, who helped soldiers go back to their pre-war lives. Thank you. And the first physical therapists were Margaret Sanderson, and Mary McMillan. Margaret Sanderson was a physiotherapist who worked with Dr. Joel Goldthwait, the chairman of the War Reconstruction Committee of the American Orthopedic Association. In 1917, he appointed her as a supervisor of reconstruction aids, but she got married in 1920 and withdrew. The training program for reconstruction aids took place at Walter Reed General Hospital, assigned to Mary McMillan, who had received her degree in the science of physical therapy. In February 1918, Mary became a member of the U.S. Army Medical Corps, where she was a reconstruction aide in Walter Reed General Hospital. In June 1918, Mary was asked to go to Reed College to train reconstruction aides of the War Emergency Training Program. Her contribution helped Reed College become the standard by which other emergency war training programs were measured. In 1919, Mary became the chief reconstruction aide at Walter Reed Hospital. In 1920, Mary resigned, and in 1921, she published her book, Massage and Therapeutic Exercise. What a great woman. After this, the development years, 1920 to 1940. On January 15, 1921, in New York, McMillan and 30 former reconstruction aides created the first association of PTs, known as the American Women's Physical Therapeutics Association, AWPTA. Mary, of course, was elected president. During the first year, there were 274 members from 32 states. Amazing. The official publication of the association in March 1921 was called the PT Review, which was a full text of the Constitution and bylaws of the association. In 1922, the name was changed to American Physiotherapy Association because it recognized men also practiced physiotherapy, and new schools of physiotherapy were opened at Harvard Medical School and in New York City. By 1923, the association grew and Mary stepped down, giving way to Inga Loney. In 1926, the Committee on Education and Publicity was made to draft the minimum standard curriculum for schools offering the course in physical therapy. And the committee published in 1928 recommended a 9-month course with 33 hours physical-related instruction per week. In 1939, there were 11 schools that met or exceeded the standard curriculum and 14 approved physiotherapy schools in 1934. It was growing. During 1920s and 1930s, PT physicians became organized to belong to the American Medical Association, also known as the AMA. In 1925, the American College of Physical Therapy, ACPT, joined the AMA, but changed their name to American Congress of Physical Therapy. During the 1930s, the American Physiotherapy Association worked with the AMA, and in 1940s changed their name to Physical Therapists to not confuse them with Physiatrist. By the 1930s, the American Physiotherapy Association was confronted with growing poliomyelitis, causing infantile paralysis, and the Great Depression of 1929. Franklin Delano Roosevelt, the President of the United States at the time, helped the physical therapy profession gain recognition due to being treated for poliomyelitis. And furthermore, the Depression closed many hospitals, but the National Foundation for Infantile Paralysis was founded in 1937 and saved physical therapy. And then after that, it was the fundamental accomplishment years from 1940 to 1970. Catherine Worthingham, president of the American Physiotherapy Association during World War II, from years 1940 to 1945, was the first PT to hold a doctoral degree in anatomy. Amazing. In 1941, before the bombing of Pearl Harbor, the first war emergency training course of World War II was initiated at Walter Reed General Hospital, directed by Emma Vogel, with reconstruction aids now being called physiotherapy aids. So not reconstruction aids anymore, now physiotherapy aids. In 1943, the U.S. Congress passed a bill that the graduates of the course were now to be called physical therapists. In 1946, PTs increased their hospital-based practice thanks to the Hill-Burton Act and the founding of a nationwide hospital building program. And they also expanded more in 1950s with the Korean War. By 1944, the American Physiotherapy Association created the House of Delegates, and physical therapy physicians practicing physical medicine changed their name to Physiatrist in 1946. Along with the association now being known as what is called today the American Physical Therapy Association, or the APTA. In 1947, the curriculum increased to 12 months for PT school instead of 9, and there were 31 accredited schools by 1950s. By 1959, most states had licensure laws adopting the Physical Therapy Practice Act. In 1951, the Joint Commission of Accreditation of Hospitals was formed. Polio was very much a thing that PTs had to deal with until 1955, when a massive national vaccination program started the Salk vaccine, which eradicated poliomyelitis cases. Nearly eradicated poliomyelitis cases. In 1954, Jesse Wright introduced the abridged muscle grading system. The role of the PT expanded to a professional practitioner in the 1950s. And by 1959, the 45 states in Hawaii offered licensure. 1962 through 1964, the official journal changed from PT Review to the Journal of the American Physical Therapy Association, to the Journal of Physical Therapy, and then to Physical Therapy with the help of the editor Helen Hislop. By the 1960s, the PT profession was increasing due to a great number of elderly and the Medicare and Medicaid programs in 1965 and 1966. In 1967, the APTA set the foundation for the creation of physical therapy assistants. There was too many already, so they needed assistants. By 1969, physical therapy assistant changed to physical therapist assistant, what is known today. After that, there was the mastery year, 1970 to 1996. In 1969, the first 15 PTAs graduated with associate's degrees from Miami-Dade College and College of St. Catherine. By 1973, PTAs that were eligible were admitted as affiliate members in the National Association, having different rights. In 1983, PTAs formed the Affiliate Special Interest Group. In 1989, the House of Delegates approved the Affiliate Assembly, which gave the PTAs a formal voice, with the president being Cheryl Carpenter Davis. In 1972, Congress added physical therapy services to the Social Security Act. In 1975, the Individuals with Disabilities Education Act was passed, which helped physical therapy treat children with disabilities in public schools. It was great. By 1976, all states had licensure laws for PT, for physical therapists. In 1981, the House of Delegates had a policy that the PT practice was an independent practitioner, meaning people didn't need a referral from another physician for PT services. Going back, during the 1970s, the APTA formed sections for state licensure and regulations, and in 1977 became the only accrediting agency for all PT and PTA programs in the United States, Europe, and Canada. In 1978, the American Board of Physical Therapy Specialties was created by the APTA to allow members to receive certifications in certain specialty area. The Women's Health and Geriatrics were created by the late 1970s. The Women's Health were known as something else. And the Cardiopulmonary Specialist certifications were created by 1985. In 1990, the Americans with Disabilities Act made sure the PTs were involved as consultants to provide equal opportunities for all disabled people. And there were many major developments in physical therapy during these years, like in 1994, where 55% of PT programs were at the master's level. It's incredible. And after that were the adaptation years, 1996 to 2005. In August 1997, the Balanced Budget Act was passed by President Clinton, which took effect in January 1999, giving both physical therapy and speech therapy services $1,500 annually cap. It was enough money for both, and many graduates in PT and PTA could not find jobs. In November of 1999, the Refinement Act was passed, which suspended $1,500 for 2 years, starting on January 3, 2000. Nonetheless, the damage was done. Even during 2005, the Balanced Budget Act effects could still be seen. The Medicare cap in January 1, 2006 was reinstated, and PT and ST speech therapists received the same amount as before, combined. The Patient Protection and Affordable Care Act helped the therapy cap exception until December 31, 2010. So this is what helped what they were doing with the money before, which affected PTA and PTs and other and speech therapists. For the APTA, the 1,500 Medicare cap and the publication of the Normative Model of Physical Therapist Assistant Education version 1999 affected them in 1999. In 2000, they adopted new criteria for accreditation for physical therapy assistants, launched PT Bulletin Online and published the 2000 version of the same normative model. In 2001, the association launched the second edition of the Guide to Physical Therapist Practice and worked hard to maintain PT's rights for certain PT services. In January 2002, all PT programs were changed to master levels. In 2003, association bill support in Congress to allow licensed PTs to evaluate patients without a physician's referral. We go back to what I was saying before. In 2005, the National Assembly of Physical Therapist Assistants was turned into the Physical Therapist Assistant Caucus, and the Medicare Patient Access to Physical Therapy Act recognized the ability of a licensed physical therapist to evaluate Medicare beneficiaries without a physician referral. Not only to evaluate, do other things, but basically. And after that, it's the vision and application of scientific pursuit years of 2006 to today. From 2006 to today. From 2006 to today, the PT roles have become more dependent on the application of science for disease prevention and the promotion of health. The House of Delegates of the APTA has provided mission and vision statements. They have made the Vision 2020. And some of the things for the vision statements that physical therapy services will be provided by doctors of physical therapy, DPT. Consumers having direct access to PTs, and PTs may be assisted by the PTAs under supervision of the PTs. And that physical therapists and physical therapist assistants will demonstrate professionalism, which means to show the core values of altruism and excellence. In 2014, all 50 states allowed PTs to evaluate and treat patients without a physician's referral. Once again, going back to what was said before. Thank you. And one last thing, all this information was provided by this amazing book by Christina M. Barrett.